immediately after my rhinoplasty surgery, I was able to gain a perfect night's sleep last night, remaining at my inclined position. I think this was achieved through my taking the diazepam, which I had avoided the night before, but in reality it did help me gain a restful night's sleep compared to waking up with minor discomforts and additional thirst throughout the night. I was still thirsty when I awoke in the morning, but after a glass of water I felt perfectly hydrated again. Breakfast I missed, but for no particular reason. Eating has become a lot easier, and I'm not nauseous at all. I have very, very little discomfort. I still sound a little bit nasally. This is partially because of having applied the ointment again, which, as I explained in my previous videos, does cause the nose to feel more congested. I do believe I may be suffering from mild hay fever. Rather unfortunately, this is the wrong time of year for it to have occurred, but it's manageable, and I am staying indoors mostly, so I'm not particularly affected by that. Otherwise, the only discomforts I feel is a slight soreness around the stitches, the base of the nostril. This may be because of the mucus being captured over the night, but it tends to fade away by mid-evening, and it's not too discomforting at all. As for bruising and swelling, I think the swelling has peaked and is now starting to decline very slightly. This patch here, which looks quite swollen and is slightly tender, is actually exaggerated in the camera because I now have bruising under my eyes, which is obviously causing that to look very highlighted. The bruising, however, isn't so significant. It's more predominant in my right eye as to my left, and it looks equivalent to a very light black eye. Again, I'm sure makeup could cover this if I wish to, but it isn't bothering me particularly, so I haven't bothered to attempt to hide it in any way. The gauze is no longer necessary, but I like to wear it after I've cleaned out my nostrils during the cleaning process, since the removal of the debris does cause a little bit of blood to flow and a little bit of mucus to flow that is easier if I capture. I tend to remove this about 20 minutes after I've done that. I've not been taking any additional painkillers, including the prescribed ones, since I have no reason for it, though obviously I have maintained my course of vitamins and other prescriptions that are provided to help with the swelling and the other healing processes. I do get some discomfort around the stitches on the very base of the nostrils here and here, although I generally find this declines once I've cleaned them out from all of the dried blood, and that just means I'm more attentive to my cleaning process than I expected I would be, but ultimately I'm sure that's a very good thing. Anyway, eating is still slightly difficult. I have maintained a diet that doesn't consist of chewy foods, so everything is stewed and souped, and that's helped me not have to sort of push on my lip too much, which again pushes up on the nose, which is a little bit painful. So I've avoided that. I did have some light itching under the cast, which was mildly irritating, but again, nothing one can particularly complain about. It's very akin to if you've ever had a broken arm in a cast, you tend to have some healing under there too, which causes the itch. It's annoying, but if you forget about it, it does go away very quickly. Obviously, this is not a particularly great area to touch or scratch, so I've avoided doing that. Otherwise, the effects are completely minimal. I look like I'm healing quite well, although it's hard to really gauge, and I'm very happy so far. I've returned completely to my normal working duties, up early in the mornings, and although I'm working from home, I can focus the whole day, and towards the evenings I just have a more relaxed schedule. I might watch some TV or read a book rather than my normal active activities. As prescribed, I'm trying to keep my blood pressure lower, but I'm feeling better every day, and I'm now looking forward to seeing the results when I get to remove the casts in, I believe, 3 days. So thank you for paying attention to this video. I'm afraid I don't really have anything else to update because it's all very much going to plan. I'm very pleased, and there is no ill side effects whatsoever. Thank you very much.